Good afternoon. It is the 14th of January 2021. This is Dr. Deepak Natarajan, Senior Consultant Interventional Cardiologist from the Heart Center, New Delhi. There have been two very interesting publications. One is a full publication in the New England Journal of Medicine, printed on the 23rd of December last year. The other one is a preprint, which has been endorsed by Public Health England yesterday. About the first paper, this included about 12,000 odd people, and they tested these health workers for antibodies against COVID-19. Of these, about 1,200 did have antibodies, suggesting that they had been infected earlier by COVID-19. And then they followed these 12,000 odd health workers for almost 7 months. And the researchers found that there were about 200 odd or about 230 infections in the group which did not have antibodies against COVID-19, which means that in the group which had not been infected, there were, over a period of 7 months, about 230 infections. As opposed to this group, the other group, which did have seroconversion, which means that they did have antibodies against COVID-19, only 2 women got infected, and crucially, these 2 women were asymptomatic, right? So now what we see is we have an efficacy of almost 95 to 97% with natural infection. Now the same thing has been echoed by this preprint, which has been endorsed by Public Health England. This included 20,000 health workers, and these were followed for 5 months. In this cohort, almost 6,600 had been infected earlier, and over a follow-up of 5 months, it was found that only 44 people got reinfected. Of these 44, only 15 were symptomatic. So once again, we have an efficacy rate. We have an efficacy rate of more than 95% with natural infection. I am underlining these 2 studies because now we have data that natural infection is accompanied by antibody formation, and this antibody by and large protects you from reinfection over a period of 5 to 7 months. We of course don't know the entire duration of antibody protection, but we now do know that in the event of a natural infection, a person would be having antibodies at least for 5 to 7 months, which would be good enough to prevent a reinfection. And we still do not know what is the situation where T cells are concerned, because as I have mentioned repeatedly earlier, that T cells against SARS infection, that is the SARS-CoV-1 infection, was seen to last for 17 long years. Now, I talk about natural infection and immunity developed by natural infection because of a report which was published about 3 days back in the New York Times. So this report has to be taken seriously, because this report describes the death of a 57-year-old gynaecologist in the United States who got vaccinated by the Pfizer vaccine, and then after 16 days had a brain hemorrhage and died. Now the story is that this good doctor, a practicing gynecologist who was apparently in the pink of good health, took a shot of the Pfizer vaccine, and soon he developed what is called acute thrombocytopenia, which means his platelets dropped drastically. We know this, we are aware of this. This is seen in dengue also. But of course, in dengue, one doesn't have a very severe reduction of platelets. But this gentleman had a severe acute fall in his platelet count. And by some reports, it was almost 0. He was managed for almost 2 weeks. And doctors tried their best to boost the platelet count. However, on the 16th day, sadly, he was found to be collapsed because of a brain hemorrhage, and this could not be treated, and the good doctor died. Now, this story I am telling you, I am reiterating it because this has already been published in mainstream newspaper, and a very esteemed newspaper, that's the New York Times. And this is not a suggestion that we are talking about not taking vaccination, but it is common sense that we keep in mind that with any tablet that you take, even if it's a Combiflam tablet, or with any procedure that is done. I do stenting, I do angiograms, I implant pacemakers, I implant devices. There is always a chance of things going awry. There is always the possibility of an adverse effect. Sometimes these could be serious. For instance, in the process of stenting, there is always a chance that a few percentage of people would develop restenosis or even stent thrombosis, which could be catastrophic. Now, this is explained to the patient concerned. Of course, when you do a stenting, the patient is already very ill. He probably is having a heart attack. So therefore, the adverse effects are accepted. And this is not the case, however, in vaccination, especially in vaccination, crores of people who are healthy, who are not having any serious disease. But one has to accept the fact that we will come across unprecedented adverse effects. We will come across, although they would be very rare, these effects will be encountered in the next few months, for the next 1 year, when the vaccinations begin in this country and across the world. The adverse effects can be varied. There would be anaphylactic shocks, and we already have about 20 people in 2 million people vaccinated, which gives us a prevalence of 1 per lakh. But these things will have to be kept in mind. So therefore, the important thing is that the pros definitely outweigh the cons in the case of vaccines. So one should not hesitate. One, of course, has to be cautious. The system has to be sensitized to the fact that there are bound to be some side effects. Some could be serious, but a lot of them could be incidental. By incidental, I mean that, every day, every hour, people are dying because of heart attacks. There are people who are having strokes, people who are having paralysis. Now, this may not necessarily be because of vaccination. In the US alone, almost 150 people every day have what is called Bell's palsy. This, of course, is reversible. This is paralysis of the face, of half of the face. About 250 people develop Guillain-Barré syndrome. This is again a paralysis of the body, and sometimes this could be serious. Sometimes this could lead to deaths, but largely this is reversible. The point I'm making is that if a certain gentleman or a lady gets vaccinated today and after 2 days develops a heart attack and dies, that does not mean that the vaccine has triggered the heart attack. The more likely explanation is that this was an incidental death. The person was harboring heart disease, and somehow the inflammation in the body was enough to trigger the rupture of the plaque in the coronary artery, which led to the heart attack. And if the person could not be treated in adequate time, then that person was found to be dead. Now, again, I am emphasizing that undoubtedly there would be some adverse effects, there would be side effects, but these would be very, very uncommon. In fact, they would be rare, and as time goes by, we will become more aware of this. Now, if you have liked this video, kindly do subscribe, do press the bell icon, and do share this video with as many people as possible. Thank you very much for watching this video and listening to me. Thank you very much once again.